Hi, welcome to our Wellness Check segment. I am Dr. Chema Kwame and presenting to you today from Elevate Medical Clinic. And today is featuring Mr. Victor Francis of Fortress Fitness. And today we'll be discussing men's health and men's mental health.
Yes, thank you so much for having me in this segment.
You're also welcome.
Yeah, so the importance of men's mental health. That's why we're here today. And as you know, this is Men's Mental Health Month.
Correct.
And I often say this. I don't recognize the month, just 1 month for men, because men struggle from month 1 to month 12.
Exactly.
Right. So while we won't celebrate this month, I believe every day we as men are supposed to be checked and check ourselves when coming to our mental health, because I know that worldwide we are struggling when coming to handling life challenges and stress and things like that. And also, coming to the doctor, I think men is when coming to the percentage of how frequent men visit the doctor or actually check themselves is way beneath compared to a female or woman. Do you think so?
Of course, I see it all the time.
Yeah.
A woman will come, she has a headache that's different from her usual migraine.
Yeah.
It's just a off, but deep in her gut, she's using her intuition and she's coming at the first sign of trouble. Now, a man will tell me, Doc, I've had this severe, intense headache for years, and I'm just bypassing it to take care of the family, go to work, handle my responsibilities. But you'll see men coming in at a much later stage, and that is part of what makes men's health awareness so critical.
Well, I think that I think for men, as a man myself, I can speak of the stigma behind coming to the doctor or even sharing emotions or speaking out of issues, because growing up, you always hear men are supposed to cry, men must always be strong and things like that. And it's taken over mind, like going to the doctor is weak. You get a headache, take it, suck it up, that kind of thing. And I just want to say, as a man myself, that is so wrong. So I tend to lead, by example. So, for this month and every month, I often, recognize, say something on my page when coming to men, and not just in mental health, but overall wellness in general. But today we're talking about mental health, but I believe we should be overall health as well. And one of the things that I want to say to men out there, as I'm in the doctor office, things like the PSA check, I think that's important for men. So, Doc, how important it is for men to come do that check?
PSA is pretty critical. And when men hear about prostate cancer and prostate issues, they immediately get tense.
Yeah.
Some men close up. Some men don't even want to have the conversation.
Yeah.
But what's really important to understand is that, yes, a man or anybody might feel a particular way about an illness or disease, but remember, sometimes these things are no respect of persons. They don't really come at the convenient time, and it really is about prioritizing men's health. And prioritizing that. The PSA is so critical because now more than ever, we are seeing for the first time in quite some time, even younger generations or men of younger ages suffering from prostate cancer than we've ever seen before. Now that is multifactorial, not just due to genetics, but also due to environmental factors, food exposure to carcinogens, or what is better known as cancer-causing agents in the food and chemicals and various entities that we interact with every day. So now the risk factors are much more common and the exposure risk is a lot higher. Now, what a lot of men don't understand is that the PSA test, unlike the physical exam, really just requires a blood sample. And sometimes I'll have men come in here and they have tattoos, and then they tell me they have a sleeve, and then they tell me they can't have a sample done to take the PSA test. So we walk everyone through it, no judgment here. But the PSA is critical to understand what your levels are, what your risk factors are. However, it's not just the test. It's having a consultation with a verified and certified physician to help you analyze what your numbers mean, because the numbers influence how often you should be screened. And not just that, your family history. So for men who have had relatives or an uncle or even a brother who has had prostate cancer younger than the age of 60, somebody who here has had prostate cancer in their 40s or 50s, it now changes your risk factors. So you have to not just screen earlier, but also more frequently to catch this early.
So you think like more frequent, once a year, twice a year? I think
yes, based on your value and family history, it will influence your frequency to have that screen. So it can go from annually, an annual check, that is if your numbers are really high and your risk factors are great, an annual check. It can go from that to 2 to 3 years. Or if you have very minimal risk factors, not of significant family history of prostate cancer or none at all, then you can do that. Some will recommend every 5 years, right? And longer. So it all depends. It's really individualized. There's no one size fits all, because everybody's story is different. Everybody's family history and medical history will be different.
So you think that the mere fact that is, this prostate cancer is a big thing in this world, not just in Trinidad and taking over our lives. How important is overall wellness for men, like activities like exercise, nutrition, watching what you eat, going back more to the old-fashioned foods, less processed, something like that. I don't say it is really the answer, but do you think that will help?
It is. It is a main factor because, like I would have alluded to earlier, any of these disease processes, most of them we are seeing And the history and research would show that they are multifactorial in their process. So they'll be influenced by various factors. For instance, it's the same reason you would find a smoker or an illicit drug user being at higher risk of encountering certain health issues with respect to someone who is eating a little bit healthier, watching their access to processed foods, and not only that, simple things as processed meats. Those are highly carcinogenic and cancer-causing entities in a lot of processed meats because of the chemical exposure. So sausages, bacon, all of these cold cuts, a lot of them. So you would hear a lot of people have to change their diet now to promote healthier cell growth, to promote healthier function of the body, because some of these foods actually feed cancer cells.
You know, as you mentioned that, you know, on this journey that I'm on, I've met people who had cancer and who have cancer actually. And one of the biggest things that I think that challenges people when they get the news is changing the diet and maintaining it. You know, because some people, you know, can really get themselves a fighting chance to really change the diet, but after all these years of eating a particular way, find it difficult to change the diet to the diet that the doctor would recommend in order to give themselves a chance. You know, because of familiarity when coming to traditional eating. You know, so when you say processed food, which we agreed, you know, some people can't give up their hot dogs and they can't give up their
and that is true. And I tell persons, the earlier you start, the better. And the more realistic you are, the better. Because sometimes we will tell someone, for example, what's your diet, what's your sugar intake, your oil intake, right? However, it's not as simple. Because remember, a part of eating and a part of diet is also the mental aspect, right? That brain-gut connectivity aspect. So that's why we have cravings. That's why the body responds to certain foods. And because not just of habit, this is what you've been doing all your life.
Yeah.
And this is what your body has come to expect. So what you have to do now is something similar to retraining. So it's where if you're cutting out something, you start with a gradual effect, unless it's really immediately life-threatening. However, let's just say something as simple as your diet, you're cutting out sugar. I'm not going to tell someone who's had sugar all their life, cut out all of your sugar tomorrow. I might want to tell them that, I might give them advice, but is it really realistic? No, it's going to push their body into a state where they're craving what they cannot have overnight. So it's why really graduating to that level is important, but you start a little at a time. If you use 5 tablespoons in a cup of tea, you go down to 4. You do that for the week. You get your body accustomed and your mind accustomed to what is going on, even your taste buds. So a lot of eating, it's complex. You think you are feeling for it, but really and truly, it's your body sending signals to you to make you feel as though it's your idea, but it's not necessary, right, that way. So that's important.
Well, I think that what we struggle in this country, and as we're talking about men, let's just keep it to men, is lack of information, proper information, because social media have been, you know, guiding us down the wrong road, you know, and, you know, boosting men's ego, but not really guiding them in the right direction most of the time. You know, so for instance, you know, you'll see a lot of topics on, you know, natural health, which I have nothing against, and you'll see people pointing away from going to see a doctor and taking it to the bush.
Yes.
Right? And now I believe everybody have their place.
Yes,
you know,
I agree.
because I believe in herbal medicine as well.
Correct.
But I also believe that you know, medical doctor has a place and we need them the same way we need some herbs too.
Yeah.
Right? So I believe it's a balance but most important, getting information and going with the right people get information to guide you in the right path when coming to being a healthy man or a guy that really want to see themselves live to a later stage in order to, you know, enjoy the family and the fruits of the labor. You know, but a message out there, Doc, for men who will be watching this program, what is the message that you think that you want to put out there for we Trinidadian men? Because let's talk about Trinidadians. Here we are, the Trinidadian men who struggle with this prostate cancer, but that just is the end result. But you know, we want a message that can really, you know, inspire them. You know, to them, yes, it told them how important it is and what prostate cancer can do. I think everybody knows what is the end result of that. But how can we get them in the office? You know, we want to get them in the office, you know, because I already doing my thing, but I want to get them here. So you have to, you know, help me get that message out. You know, what message through the platform you think you can say to me so they can see to change the narrative, the false narrative that we have in our head? Because I know a long time, you know, the prostate exam, the physical part of it, you know, before it modernized, now with the digital and all that was scary.
Yeah.
You know, and I mean, we have a phobia. Women have a phobia. I mean, and I have a serious phobia with that, right? You know, I did the PSA a couple of years and I did once a year, but that's kind of, you know, that's easy. Right, but I think a lot of men might even understand what PSA mean.
Correct,
right?
and that's where the education comes.
Right, so I think you could touch on that a little bit and just say something that could probably enlighten and encourage these guys and them to, you know, it's not a death sentence as you mentioned earlier on. It's early detection. Yeah?
Correct. First thing I would say is that a strong man is not just necessarily the one who is taking care of his family, going to work every day and prioritizing his work life and enjoyment. A strong man is also one who prioritizes his health and gets in front of it before it gets to the stage where it takes either him away from the ones he loves or takes away everything that he loves. Because that is important, because what are you then teaching your sons? They're going to see you avoiding healthcare, avoiding making routine checks and comprehensive medical checks a part of your daily and a part of your lifestyle. So they're not going to see you going to the doctor, so they're not going to really emulate that. So that is one important factor. But I would also say prioritizing someone's health is really about a personal decision. And that comes down to what you value. Because men spend time, and not just men, everyone, they spend time on what they value. And health is pretty critical because, yes, we have a lot of hardworking men in Trinidad, and I know the culture is such that we're not going to make time for the doctor until it's severe.
Yeah.
Until it's absolutely severe. And it doesn't have to be that way.
Yeah.
Finding a trusted professional who is going to have you in a confidential space, in a judgment-free zone where you can openly discuss, ask your questions. And medicine is not just about treating the patient, it's about educating and empowering them. And that's what I believe. So here at Elevate Medical is really important for us. Anybody who comes through the door, is to get them educated. You can ask any of my patients. When they walk out that door, you can ask them anything about what we discussed. And they're educated, well-informed, and empowered. So that is the stage that men have to understand. It's about information and empowering yourself. The more you know, the more benefit you are to yourself and your family. So not just the PSA, not just when it comes to prostate exam, but there are many men suffering, and young men, from hypertension, high blood sugar, high cholesterol, leading causes of strokes, leading causes of fatal heart attacks. And these are the things that, if tackled early, and you're guided on exactly what you need to be doing, the frequency, the intensity, it could really save you a lot of headache later on, or even now. Save you, both you and your family.
Yes, well, Doc, I have two things to say. One is that, yes, women, go there and work hard, and but I think in our head, I am guilty of that as well. In spite of what I do, but I kind of retrain my mind. That's why I'm doing all the trying to motivate and men out there. But I think society as well push us in a corner where we, as a provider, we feel that we have to take care of ourselves last. We have the family, the children, the wife, the house, the bills, and I think that we tend to feel that ourselves just, without us, that things wouldn't happen. Right? No, I'm not saying that is true, but that's the narrative we have in our mind, because, as growing up as a young boy, you're hearing a man's supposed to provide. It doesn't mean that as a woman or wife or whatever is not working, but in our mind, we are providers, and I think we are created to be providers, right? So that's probably part of the lack of education and the stigma that we have to break. Some of us breaking it, and it's not just and I want to say this, guys, it's not just going to the gym and looking all buff.
And looking buff.
There's a small portion, because I often say that being buff or looking fit doesn't mean that you're healthy. That's two different things, right? So men who feel going to the gym or going to Savannah and run and all that, that's great, but it's just a small piece of the pie. You have to come get yourself checked, and as Doc rightly said, get a trusted physician that you can have this dialogue like what we have now is important. And also, as you mentioned about hypertension and diabetes and things like that, each week we'll have a session here. So next topic may be one of those.
Yes,
and the importance,
we will address that.
Yes, for men, because for men it affects them in ways that I know they don't want to be affected.
Correct.
Right? And yes, men, I know.
Yes.
Right? It's time. We open now. It's not about shame thing, because
yes, exactly.
I'm a doctor, and basically we know what it affects. Diabetes and hypertension affect us in ways that we really don't want to. Especially when we come into certain parts of living and life.
Yeah.
Right? So Doc, I know we have to go until next session.
Yeah.
I want you to just say a word of encouragement again. Closing word coming from Elevate Medical, and I want to say thank you for having me.
Not a problem at all. Thanks for being here.
And Doc is my personal. I made her my personal physician, because I take in front, right, guys? I lead with an example. It's not about aesthetics. It's about overall wellness, and I trusted my health and my overall wellness, not just in the gym, but coming to the right advice and the right guidance from Doctor here and Eastern Main Road, San Juan.
Number 130 Eastern Main Road, San Juan. This is opposite Furniture Plus. And we can also be reached out at 788-3644 via WhatsApp or call. And interestingly enough, this month, as we into the talks about men's mental health, men's health awareness, there's also a men's health package currently ongoing on Elevate Medical Clinic. Okay. So it involves your full consultation. We're going to go through all of your history, your medical history, family history, and pull out those things that are critical to you. In addition to all of the things that we do here as Elevate Medical. So we're going to assess your joint, any joint pains in that package as well. And going to assess hair loss and all of these things that are common to men, and see exactly where the help is needed and how quickly we could get you to tip-top form and shape. So not just looking good, but feeling good.
I didn't watch me on that one.
Yes.
But, no, but
yeah.
truth, and as Doc rightly said, it's not, it's not just a physician whereby just to check your, if you're sick or whatever. She do other services as well. And women, too late for me, I don't got bored already. I don't want to hear again, But seriously, male and female, if you're having problem with hair loss and things like that, that can treat you and help you. So, let's come on down. I mean, she's on social media as well, right? And so thanks for joining us.
Yes, thank you for coming to the segment, checking into the wellness segment. We'll be here with a brand new topic. Might see a lot of new faces coming up, and it's going to be so exciting for you to gain a lot more information and eventually be able to call in and ask your questions and get them answered in real time.
Yes.
And we'll be happy to help you. So, men, take care of yourself. Your family needs you. Your community needs you. And Trinidad and Tobago and Extension, we definitely need you. So we need all the wonderful men in our lives to be healthy and happy and available for their families, to be able to go out there and do what they love and fulfill their purpose.
Yes.
But we need them healthy as well.
Yes.
So at Elevate Medical Clinic, we love to take care of the men because they're the cornerstone of the society and the family. They are really the genesis of everything. So in terms of legacy. So we really need our men around to be in top order and top form.
Yes, ma'am. So listen to the doc and come on down.
Yes.